Much.
And Devin, of course, talking about summertime. We are in it, right? And as it rolls around, we're spending more time outdoors. Does that mean for you different types of injuries? Sending you to the doctor's office. What are the most common summer problems? I have a local doctor here next. He has reminders and tips to stay healthy and well. Got Dr. Bryce Peterson joining me now in studio. This is a sponsored segment with the Ogden Clinic, and you're with Cope Family Medicine. Just joined the Ogden Clinic, and we asked him to come on to talk about those common summer issues that you might be having with your family that need medical attention. The first question I have for you is, how do you know if it deserves an ER visit or maybe a visit to your family doctor?
Yeah, it's a common question. A lot of people do have many problems that go on, and sometimes they do need to go to the ER. If you've been shot, I would recommend going straight to the ER. Crushing chest pain, straight to the ER. Chest pain that you're not sure is crushing, you don't have a history of heart problems, we can take care of that most times in a family practice setting. We deal with broken bones, many lacerations. I sewed up a kid's ankle just the other day, had probably a 6-inch gash in his ankle from a weed whacker. We do take care of lots of that in a primary care office.
Well, and speaking of a weed whacker injury, what are the most common types of injuries that you're seeing right now during the summer?
Yeah, now that the yard equipment is out, that really is a large driver of injuries during the summertime. People not wearing a closed-toed shoe and a rock comes zinging off of the lawnmower, weed whackers, bikes. Fall, you know, break your wrist, or hiking and break your ankle or twist your ankle. Those kinds of injuries are really becoming more common.
My kids were jumping on the trampoline just last night, and I was like, you always take a deep breath when anyone gets on a trampoline during the summer. I'm sure you see a lot of those. How can we avoid getting insect bites? Zika is so top of mind right now. Do you get questions about that?
We do, all the time. Zika, thankfully, is not here in Utah yet. We do have the type of mosquito here in Utah where it could potentially be here, but it's not a problem yet. So we don't have to worry about Zika here in Utah. Good to know. The best thing we can do to try to avoid getting insect bites is to, number one, wear long sleeve clothing. Very effective. But DEET, the chemical insect repellent, is also exceptionally effective. If you're having a barbecue, the other thing that I'd recommend is a simple and effective matter. Go put an oscillating fan on your food table. A mosquito is so weak it can't fly against that wind. So that can help keep them away. Yeah.
Keep your food down and the mosquitoes out, right? What about poison ivy if you're out there hiking? How do you avoid that?
Very common. First thing to do would be try to recognize it and stay away from it. And the common mantra is leaves of 3, let it be. Okay?
I remember
so if there's a little stem coming up with 3 leaves coming off that stem, try to not touch it. And those poison ivy, poison sumac, poison oak, stinging nettle, they make a chemical that our body is allergic to. And if you do notice, I'm sitting in the middle of a bunch of poison ivy, get out of it, first off, of course. And then as soon as you can, soap and water. Minutes matter to reduce. That's all you need to do. If you're by a stream, get water on it and try and wash that off as soon as possible.
All right, before we have to go to commercial break, I want to ask you about food poisoning. This is happening at barbecues. I mean, you're eating food maybe you're not always eating this time of year. How do you prevent it?
So first off is proper food handling, trying to keep the chicken separate from everything else before it's been properly cooked. And then, of course, egg products as well, and not letting things be out in the sun for too long before they're consumed.
Well, it's hot. Let's refrigerate. Right? Let's remember to refrigerate. Ogden Clinic, they're so great. They have answers to your questions. If you have any, that is their website. Please go to goodforutah.com/midday for all the information. And Dr. Bryce Peterson is with Cope Family Medicine. It's so good to see you. Thank you for answering our questions. Emily and Brian, there were a lot of them. It is summer. Back to you.
Thank you very much. We appreciate it.
Now, the 4th of July.